17-month-old Colby Ramos-Francis was born with a rapidly growing hemangioma, a form of benign tumour on his eye. And when his desperate parents felt they couldn't get the help they needed in Britain, they appealed to a US charity for their son's operation.
It's just really scary and we just needed to get help fast.
Colby's parents, Aimee and Jamie, realised something was wrong shortly after he was born.
Straight after birth, he had a small pink birthmark on the side of his eye. I wasn't really that concerned about it because a lot of children are born with them. We waited until a 6-week checkup. By that time, his birthmark had ballooned and it was really bulbous and it wasn't really a nice sight.
Treatment was started, but proved ineffective.
When Colby was a couple of months old, we went to the doctors who immediately referred us to an eye specialist at Bristol Hospital. We had our first appointment with them, which we waited about 2 months. During that time, Colby's birthmark had split open and bled a few times. We were panicking about this. We finally got to our appointment and they decided that propranolol was the best thing for Colby. Over the past year or so, every time we see them would be once a month and they'd keep upping and upping his dosage, but it never shrank, did it? So I got on Facebook, found the Facebook group of the hemangioma parent support group, and just putting a post on there really helped. I mean, all these different parents, they're having exactly the same issues and they know.
That we got on it straight away and everyone was so helpful. She's done an incredible job.
Aimee's efforts resulted in contact with the Little Babyface Foundation, who agreed to cover their costs to travel to New York, where a team of world-renowned specialists would operate on Colby.
So nice to meet you too. Come on in and have a seat.
Dr. Thomas Romo III is one of the founders of the charity, committed to helping children born with facial deformities.
Colby has a congenital vascular growth, a benign tumor called a hemangioma. And hemangioma can be on any part of the body. It's the most common tumor growth that children have. And his particular one is so bad because it's actually blocking his vision, which is going to delay or maybe prevent that eyeball from ever seeing. We perform surgery on children with hemangiomas regularly. And the surgeon who'll be leading the team, Dr. Milton Weiner, who I'm an associate of his, is an internationally known hemangioma surgeon. We don't consider it a loss or a failure if he needs another surgery. It's worth getting 85% done, letting it heal, and then come back and strategically putting soft tissues and delicate things back into place to improve them so that his eye works at 2 years old and at 22 years old and 62 years old.
Finally, the day of the operation has arrived at New York's Lenox Hill Hospital.
I had a surgery, nervous, but glad that it's going to be removed finally. It's a burden lifted. This morning I felt confident about it and I'm still confident now. It's just that it's real.
Okay, let's go guys. John, let's go. Okay, Mom. Let's give Dad a big kiss and don't worry, Dad, we'll take care of him, I promise you. Okay? Don't worry. When you see him, he'll look different. So
Yeah.
Don't worry.
Let's think about him, think about the birthmark.
Dr. Milton Weiner is prepared for the difficulty of the operation.
So the muscle that lifts the eyelid is probably involved, so I'm going to have to find that muscle and preserve it. So the first objective is to remove the hemangioma without damaging or destroying any of the structures and trying to make sure that the eyelid is the right length and still works. There may be a second small procedure, but I'm hoping not.
Dr. Romo is equally upbeat.
I think things are looking wonderful. You have the combination of incredibly generous physicians that dovetails in with the foundation, which provides the fiscal capability of doing something like that. And what's so wonderful is this young couple had the opportunity to utilize those services. It can't get better than this. It just really, literally cannot get better than this.
And after a 3-hour operation, he's even happier.
The tumor's totally out. It's just there's some little finesse things that have to be done. We're going to let this settle down and heal up a bit. And because he's going to be growing, the thing's going to be pulling as well. And then we'll come back and do a little finesse thing in 6 months or so.
Relief.
Eyelid's a bit swollen.
So happy. Really happy. That's all I can say at the moment.
Okay, guys, how are you doing? Okay, thank you. Good. Hi, Colby.
Just over a week after the operation, Colby has a checkup.
It's draped properly.
And while he will need a further procedure on his eyelid once the swelling has reduced, his parents are understandably relieved as they prepare to return to the UK.
How about me?
Give him 5.
There you go.
To see Colby without his birthmark is absolutely amazing. We can already see that he's a completely different little boy. He's changed so much. He seems much more confident. He's realised that it's not there anymore. Colby's had children approaching him now. He's been playing with children already.
It's nice to see him socialising with children his own age and playing about like a little boy should. I'd just like to say thank you to all the surgeons that have helped Colby and helped us through.
Allowing us to come over here and paying for everything. Absolutely amazing what they've done.